What is dengue? Dengue is a viral infection, and the symptoms of dengue include muscle aches and pains, headache, very high fever, sometimes bleeding, and sometimes a very severe disease called dengue shock syndrome. My name's Cam Simmons. I'm a Victorian scientist here at the University of Melbourne, and I study dengue. How do you get dengue? You get dengue by being bitten by a mosquito carrying a dengue virus. When a mosquito carrying the dengue virus bites you, the virus in the mosquito gets inoculated into your skin, the virus replicates in the cells in your body, and this is what makes you sick. If you get bitten by a mosquito carrying the dengue virus, there's a range of possible outcomes. Many people don't get sick at all. Some people get very sick and need to go to hospital. The symptoms of dengue are caused by the virus replicating in the cells of the body. If you do get dengue and you get sick, the good news is that your illness usually only lasts 5 to 7 days. The bad news is that you can get dengue again sometime in the future. Where are you most at risk of getting dengue? Well, dengue is a very common disease in tropical countries, and particularly Southeast Asia, where many Australians go for their holidays. Dengue is a very common disease in tropical countries. Last year, we think there were 100 million dengue cases globally. Most of this illness and disease occurs in children and young adults just like you. Dengue is called an emerging disease because it has become a major public health problem in the last 30 years. How can we fight dengue? There's a lot of work going towards vaccines to prevent dengue. There's a lot of work going towards drugs so that we can treat dengue patients better. And in the meantime, we continue to try and fight the mosquito that carries the dengue virus. Dengue is a major public health problem in much of the world. Every year there are dengue cases in Northern Australia. So this is a problem for all of us, and now it's over to you to learn more about dengue.